Kwedeberry. Che Alai. My name is Dr. Peter Louis Ndifo. I do for Limbe. This is the second topic we will talk here for this cardiovascular disease. Them now the risk factors. Risk factors means which means way you will get and way will predispose you for getting cardiovascular disease. Them. So now who get risk factor for develop cardiovascular disease? Every one of we, everybody get risk factor. You get high risk for develop cardiovascular disease. Now the other point we different I say some risk, them they be more than other risks them. And then some, if you get a combination of risk factors them, it increase your chances them for get the risk for developing cardiovascular disease. And then the other point we different I say if you get the risk factor we control them, the chances for you for develop that illness will be very high. So straight up, we'll go. The risk factors will be divided into three big groups. Then. Number one, the one group now risk factors and we fit prevent them or we you fit actually control them. The other one risk factors and way they fit treat them for hospital. Then the third class of risk factors and risk factors the way fit do nothing. Now just risk factor. So the first one, the very first risk factor, now lifestyle risk them. Where they fit actually be prevented or controlled. Number one, top on the list for risk factors for cardiovascular disease. Now smoking. Smoking, it don't be shown say now one of the preventable risk factors for cardiovascular disease because more than 50% of smokers them they develop heart attack. 20% of them they get death due to heart disease, and then when they don't realize I'm for this say if you smoke it will reduce their lifespan by about 7 years. The second one, physical inactivity. These people where they need to do sports, you really should only for one place. If you need to do sports now, very significant risk factor. The other one now for lifestyle now. The fact for this say you be obese. Obesity it means say now people the way they get more than 20% of their weight where they don't increase that weight more than. I would like to talk about one preventable cardiovascular risk factor way that's smoking. So whether that smoking it be a true smoking of cigarette or it be a smoking of that particular one way it be common for young people them where they call and say shisha, make you know say na the same thing where you the smoke. Which it happen for them I say once you smoke this, take this smoke, you get this smoke, you get two main dangerous things them, nicotine and carbon monoxide. But when you smoke and that smoke they enter inside your lungs, it diffuse inside your lungs completely, and instead for that oxygen for enter inside your blood, now mostly carbon monoxide and nicotine they enter inside your blood. And it be so devastating because see that nicotine and carbon monoxide will enter and bind inside your red blood cells them and they transport them for all sides for your skin. This nicotine and carbon monoxide they be so dangerous for your blood vessels them because they be toxic to your blood vessels them and the walls them it destroy them. And as I be talked before about cholesterol, when you get destruction of your walls of your blood vessels them, it encourage the lining them for cholesterol for be deposited for your red blood cells. For your blood vessels them, and it make they reduce in size. And you see how much it don't reduce for that size we did for this so blood it pass now only small for the now. And if at all it obstruct now for your heart, it cause you heart attack. The other one we did here now see that nicotine it go accumulate for your adrenal gland when some gland where they are above your kidney, it make your heart beat very very fast, it increase your blood pressure, and it be so devastating for your health. Apart from that, nicotine it make your platelets they clot together and this clot it actually obstruct your blood vessels them. If not for your brain where it go, it lead you for getting stroke, as we talked before. You see how obstruction for your blood vessels for your head it go and it obstruct them. All we know the complication of stroke and how it kill many people. So all we know is how stroke it kill plenty people. Then as we talk again, smoke they increase the heart disease by 4 times. We will continue this presentation for the next other video. Thank you now.